Hi, my name is Gabriella Tarana for Professor Bado's class, and I will be doing IV and IVPB back. So my 7 steps are: check the physician's orders, wash your hands, obtain your equipment, identify the patient, introduce yourself to the patient, explain the procedure, and provide privacy. And then I'm going to know my 6 rights, so the right patient, the right time, the right drug, the right route, the right reason, and the right dose. Okay, so first, my equipment. I have my tubings for the piggyback and just the regular IV. I have my sodium solution, alcohol swabs, and IV piggyback medicine. Okay, so first I'm going to open the package for the solution and make sure that you label it with the right solution and the right time. And then I'm going to take the tubing for the IV. Make sure that this is clamped. And I'm going to spike the bag. This is sterile, so make sure you're not touching it. And then we're going to come up over here and hang it. Make sure that no tubing is touching the floor. Then I am going to prime this. I have an MSN spacing under his arm, but in the hospital with the patient, we wouldn't be doing this. It would be okay. So I'm going to take this off. This is sterile as well, so make sure that the cap is facing upward. You're not contaminating it. This, you want to make sure it's filled halfway. Okay, and I'm just going to check this.
Yeah, it is fine. That's just fine.
Making sure all air is out of the tubing. And then I'm going to close the clamp. No air in the tubing. Okay. Now I'm going to get an alcohol swab. And you just want to clean this tubing and one on the patient's arm. Okay. You want to connect it. Okay. After we do that, then I want to set my drip factor. So I'm going to get my watch. And I'm going to set it 60 drops per minute. So that's 15 drops per second. 15 seconds. I'm going to start at 45. Okay, starting it now.
I'm telling you, they don't work. Unless they're a different way, you have to like snap it.
Okay. Okay, so now it's 1 drop per second. Okay.
Oh, okay.
Okay, so after I set up the IV, now we're going to go over to the piggyback. So make sure you have the correct tubing, the alcohol swabs. You want to make sure that you label the tubing for both the piggyback and the solution. Then when you have the piggyback bag, you also want to label it. Check the expiration date, which goes for both this and the sodium. Check the physician's orders, making sure that you have the right medication. So after we do that, I'm going to take the tubing out.
And I'm going to tie the gown
This we can hang up.
behind the neck.
Okay. So with this tubing,
The IV is through the patient's gown.
same thing. Make sure the clamp is shut,
And I'm going to put this in the
and we're going to spike the bag.
linens.
Again, this is sterile, so you want to make sure
No, really, I wouldn't do it over again because really,
that's
what else do you do?
contaminated.
I didn't.
Okay. And now that we hang it, we want to switch it. So this is going to hang lower because of gravity, so that one's going to go down quicker. And then hang that one. You always want it to be higher. Okay. Then we're going to make sure this is halfway. Okay. Now we want to prime this. Same thing. This is sterile, so keep the cap upwards. And we want to prime it. This one shoots out faster, so you want to open the clamp very slowly. Okay. Now that we did that, there's no air in the tubing. And we're going to get our alcohol swab. Clean it. Clean this. And then we get the primary tubing and clean that as well because we're going to attach it to the primary. Okay.
Going to remove the bottom sheet.
And that's connected. Okay, so after we connect the tubing, we're going to make sure that this clamp is all the way open to set our drip factor. So once that's open, then we're going to take the primary tubing clamp, and that's going to set our drip factor for the secondary. So I'm going to get my watch, and I'll start it at 45. I'm going to do same thing, 60 drops per minute, so 15 drops per 15 seconds. And starting now.
I'm going to change my pillowcase now so that I don't contaminate the dirty pillowcase with the clean bottom sheets. I'm going to remove the pillow from under the patient's head.
So I'm just going to, before I start,
Okay.
take this off and then move it to the middle and then.
So after my drip factor set, I'm going to leave this. Okay. And that is setting up an IV and an IV piggyback.
Phillips, and I'm going to